Awesome. Thank you so much for joining me here at the Live Desk. Again, I am Janae Hancock. And, as we all know, and we've all probably heard since the pandemic, but even before then, that there is a nurses shortage, I should say. So have been dealing with that healthcare crisis for a while now. And now here in Kansas, we are really trying to fix that issue. And I do want to bring in Dr. Amy Garcia as the University of Kansas School of Nursing is working to address the crisis, like I just mentioned. And they just launched a new center. So Dr. Amy Garcia is the director of that center, and she joins us now to tell us a little bit more about it. Dr. Amy Garcia, thank you so much for joining me today.
Wonderful. So the University of Kansas School of Nursing has launched the Kansas Nursing Workforce Center. Our goal is to make sure that every Kansan has access to nurses when and where they need them, and that nurses are supported, both as individuals and as part of a healthcare team.
And so why is this so significant? I talked about the fact that there is a shortage right now, and there has been a shortage, but why is it so significant specifically for the state of Kansas?
So nurses are the backbone of healthcare. Nurses are there 24/7, taking care of people when everyone else goes home. We have to have nurses where they're needed across the state. As the population ages, we've seen an increase in the need for healthcare, and we've also seen other opportunities for nurses. So we're working hard to make sure that we're attracting people into nursing. It is a great profession, that we are getting people through school and educating them the way they need to, and that the work environments are environments that nurses want to work in and want to stay in.
And you talk a little bit about, attracting people to the profession of nursing, but, speak a little bit more about the programs that you all will be hosting within this center and how you will attract not only college students, but as well as teenagers.
Certainly. So we will start this center. Our first priority is to get better data to understand where nurses are needed, what they're doing, how to better address that. So we're going to provide better information to employers and state agencies and nurses themselves. We're aligned with a number of the programs around the state, the STEM programs that work with students in grade school and high school to make sure that they've got the sciences and the math that they need in order to be able to be successful in nursing school, and also to give them experiences about what it's like to be a nurse. So those are good programs. I think the other place that nurses come from is people who've worked in another profession. They got out of school and wanted to be in business, or they've wanted to work in industry. And one day they say, I really want to do something very meaningful with my life. I want to be a nurse. So our workforce center will help make clear the pathways for people to become nurses.
And this is such a unique center that you all just launched not too long ago. I do just want to touch on this alarming statistic that I did receive from the press release that you all sent out, just to let our viewers know. Reports show that by 2026, we will need more than 28,000 nursing assistants, 18,000 registered nurses, and 6,000 home health aides. Now, you also touched in that press release, you touched on the fact that hospitals are in danger of closing. Speak a little bit more about that, but mainly focus on the state of Kansas.
Certainly. The demand for care here in Kansas is growing very quickly, about 6% a year for registered nurses and about 26% a year for nurse aides. So we've got to do a better job of making sure that we've got enough nurses to fill those spots. Now, Kansas has more small hospitals, we call them critical access hospitals, than any other country any other state in the US. And when you have a small hospital, your nursing staff may be 10 nurses or 20 nurses. And if one of those or two of those or five of those leave to travel and work in other states that might have higher pay, it leaves a shortage. Those hospitals either have to reduce services or close beds and transfer patients elsewhere. We saw that happening during COVID, and we want to make sure that we have good systems in place to reduce that. So good work environments for nurses and good support for our critical access hospitals. Roughly 30% of our 84 critical access hospitals are at risk of closure. So lots of systemic issues, but our part at the Nursing Workforce Center is to make sure there's enough nurses where they're needed and when they're needed.
What can we expect from the center in the upcoming months, especially as we look ahead to the fall season?
Certainly. So we're going to be working very closely with our State Board of Nursing and the Department of Commerce, with associations like the Kansas Nurses Association, the Kansas Hospital Association, employers, to really get at some of these issues and provide better decision support for our legislators. We have several programs going on right now at the University of Kansas. One of them is called ICANN, that is focused on the need for pulmonary support for patients with long COVID. So in many parts of the state, there are not enough respiratory therapists. So we're working on cross-training nurses to have those skills. We have another program going that we've just launched that looks at nurse aides and their intent to stay in their job. And I think understanding that can help us help employers keep those nurse aides happy and working and becoming nurses. Yes.
And this is very important, and if I do say so, it is very timely as well. Like you mentioned, we are entering the fall season, so you have the flu, you have different respiratory viruses that are going to be going on, as well as people come indoors and they're closer with one another. So definitely this is something that is needed because we depend on our nurses and our other healthcare professionals to take care of us when we are sick. Where can students, or even anyone who is watching right now, where can they learn more to get involved?
So we've launched a website, the Kansas Nursing Workforce Center website, and they can look there. On that website, we are new, but on that website is a list of all the nursing schools in Kansas where students can enroll and engage. They can find out there. We have some wonderful programs. We have a partnership program with the University of Kansas and 8 of our community colleges across the state, where students can enroll, stay in their community, take 90 of the credit hours at the community college level at community college prices, and take 30 hours from the University of Kansas online and graduate on the same day with a baccalaureate degree and an associate degree in nursing. It's a really wonderful way to allow people to remain in their communities, go to nursing school, and gain those skills to provide really optimal patient care.
Very interesting. I love it,
Yeah.
especially, students who just graduated this past spring, or they're looking for their next adventure when they graduate this upcoming fall. So I appreciate you, Dr. Garcia, for joining me here at the Live Desk.
Thank
Again, we will continue to follow the progress that you all make with this center, but the University of Kansas School of Nursing is working to address that nursing shortage crisis that we are seeing all across the nation. Alrighty, again, thank you so much, Dr. Garcia. I am Janae Hancock here at the Live Desk, and I know we have our 4 p.m. newscast coming up in just a bit, so be sure to tune in with us then. But for right now, we are tracking some severe weather that we are supposed to be expecting within the next few hours, so be sure to tune in with our weather team as well, as it is a Weather Alert Friday. So here's a look overlooking Kansas City right now.